Hello and welcome to this Cardiometabolic Health Congress podcast series entitled Obesity and Type 2 Diabetes. I'm Dr. Fatima Cody Stanford. I'm an obesity medicine physician scientist at Massachusetts General Hospital, an associate professor of medicine and pediatrics at Harvard Medical School, and I serve as the director of equity for the endocrine division here at Mass General. Today's joining me with my wonderful colleague, Dr. Scott Butsch, who's an internal medicine obesity medicine physician at the Cleveland Clinic. In this series, we will discuss important considerations and practical pearls about the management of obesity, with a focus in patients with type 2 diabetes. In this first part, we'll talk about how to initiate the conversation about obesity in patients with type 2 diabetes. Thank you so much for joining me today, Dr. Butsch.
Hello, and thank you for the invitation to talk today.
Absolutely. So, Dr. Butsch, as we start this conversation, I want you to really elucidate for us the burden of overweight and obesity in patients with type 2 diabetes.
Yeah, I mean, we know that probably about 80% of people who have type 2 diabetes have obesity as well. So obviously the conversation is going to happen to the majority of patients who you see. And then the burden really can be seen at the individual level. It can be seen as a financial burden where you have more micro and macro vascular complications to type 2 diabetes thanks to having obesity. So medication costs, we know that prices of insulin are going up. You see the financial burden at the systemic, at this, across systems, health systems, where, blood pressure cuffs, seating, wheelchairs have to be retrofitted depending on the severity of someone's obesity. You see the quality of life of those individuals who have type 2 diabetes and obesity partially impacted by the obesity. So it's seen and it's ever present in most of the patients that we'll see in the clinical encounter.
Well, that's wonderful. And thanks so much for really giving us, setting the stage for, the intertwining of obesity and diabetes and that significant overlap. 80% is quite pronounced. And I don't think a lot of people know that. So thanks for sharing that with us. So Dr. Butsch, I want to transition into another question, and that's asking about the biology that really connects obesity with type 2 diabetes. Are you able to explain that to us today?
I think when we talk to our patients about the connection, and again, there's a strong correlation, as I stated earlier, we see the insulin resistance model that leads to, beta cell burden and, insulin resistance that's seen in the level of the muscle and the liver. We see that obviously being a part of it. And obviously for the scientists in us, we can talk about, endoplasmic reticulum stresses. We can talk about microbiome, beta cell dysfunction, these kind of things. But also we should understand that as people gain weight and their adipocytes get larger, we're going to have that inflammatory, that systemic inflammation driving some of this relationship as well.
So those are some fancy words. Dr. Butsch, do you mind telling us a little bit about adipocytes? I think those are fat cells, right? And other things, and kind of explaining that in a way that, my sister or someone else might be able to understand.
Sure. I mean, if we look at fat cells, and we know, there's now communication since 1994, we know that there's hormones that talk to the brain. The leptin would be the one hormone that was discovered in 1994, first sort of gave us the understanding that there's a communication. Before we thought it was, just a depot of triglycerides, and these fat cells were just made of triglycerides and we'd have stored energy. But now we know that there's constant flow of a communication lines. And that really makes sense as we've learned more and more about the science and weight regulation, that it's a very complex system with the fat cell or the adipocyte being only one component.
Well, that's really great. Thanks so much for really breaking that down for us. So I want to transition to asking a question that's really gotten a lot of attention lately. And this is, why is it important to address overweight and obesity in type 2 diabetes? A lot of type 2 diabetes management up until now has been really glucose focused or blood sugar focused, but we're seeing this shift in conversation to focusing on overweight and obesity. Why do you think that addressing overweight and obesity is critical in patients with type 2 diabetes?
Well, it's really the double benefit. We know that there's an association classically we've under-recognized, underappreciated, and undertreated obesity. And so the thought would be that, well, type 2 diabetes and that microvascular and macrovascular complication and CV cardiovascular mortality are so important that we should really focus on, controlling the blood sugar levels. But as we see, even the ADA, the American Diabetes Association, and other clinical professional societies in the diabetes world have switched gears and really have a more obesity or weight-centric approach to type 2 diabetes. And it just makes sense. We know losing weight, even 5 to 10% of body weight loss, can have impressive results on controlling blood sugar levels and addressing and managing type 2 diabetes.
Well, that's really great. Now, you made some really important considerations in that last question that I asked you, and you talked about, how we're moving into kind of this more weight-centric approach, and we're looking at this, connection between overweight and obesity and type 2 diabetes. And so I want to expand that in this next question and ask you about some of the complications of obesity and how weight loss would benefit these.
Yeah, I mean, just as we understand type 2 diabetes having a multiple complications, from complications of heart and cardiovascular disease to fatty liver disease, obesity is even more so. There's more than 200 complications of obesity in every system. We can talk about the increased risk of cancer with obesity, the increased risk of Alzheimer's, increased risk of chronic kidney disease, independent of the effects of type 2 diabetes on the kidneys, quality of life, psychosocial complications, et cetera. So you can go on. And it just makes us realize the importance of addressing obesity in that clinical encounter, even though the clinical encounter might be focused or the presenting symptoms might be along, a complication or an issue with the diabetes. It's always going to be so important to address weight in that clinical encounter as best you can.
And how would weight loss actually help with all of these 200, you told me 200 plus diseases associated with obesity?
Well, I mean, it harkens back to what we said earlier of the systemic inflammation and sort of the processes in which that expanded fat cell and that dysregulation of your body's ability to control your body weight ends up complicating, complications in type 2 diabetes and in other disease processes. So addressing that, and we think it's a simple thing, just addressing weight, and that we don't realize the exponential impact that can have on other disease processes. So again, seems simple just to say, okay, let's try to help our patients have a healthier lifestyle, but also very specifically addressing obesity and treatment of obesity and the profound impact that can have beyond just type 2 diabetes.
Wonderful. And so the last question I have for you today with regards to this topic is looking at obesity as a disease. We know that it was only in 2013 that the American Medical Association first acknowledged obesity as a chronic disease. And how do you think the acknowledgement of obesity as a disease can help us really reduce stigma and bias and discrimination in obesity management?
Yeah, and several of us, yourself included, have addressed this for over a decade now. And we know the importance of addressing bias because if bias invades every aspect of medical care, research dollars, how we treat people in the workplace. So it's really important to address bias. And we've mainly focused a lot on public awareness and education around bias. But we even see, despite all this efforts that we've done, and you and I have done a lot of work in this space and spent countless hours, we see that even with a recent study as of a few years ago, the ACTION study that polled over 600 physicians who agreed that they should be part and are responsible for their patients' obesity, there's over a quarter who still believe that there should be, the patient isn't trying hard enough, that they're not motivated, that they're not interested in in weight loss. And so we already see coming even into the clinical encounter that there could be bias that is going to complicate that management of that person's obesity and also thus diabetes.
Well, thank you, Dr. Butch. I really have enjoyed this conversation where you've really helped us to understand obesity and patients with type 2 diabetes and really the myriad of complications associated with this disease. Thanks so much for I'm so excited that we've had you today here for this podcast, and thanks for being a part.
It's been my pleasure, and thank you for the invitation.